Physiological changes during pregnancy. What are the physiological changes in during pregnancy? The whole new life begins at conceptions. Then pregnancy from conception to birth, usually 40, it takes 40 weeks of the completion of pregnancy. During this period, the newborn child grows from a single cell to an infant, and the whole life outside the womb changes in the mother are anatomical, physiological, and complex, affecting the every function of the body. Then fetal system, which create the most favorable environment possible for the developing child. Lots of physiological changes are there, such as increasing of the abdominal region, and enhances the breast region, then weight gaining, etc. Physiological changes, expansion in plasma volumes and red cell mass. Plasma in a pregnant, non-pregnant woman, average plasma volume is 2600 ml, and plasma volume begins to increase by end of the first trimester and reaches a peak by 34 weeks when it is about 50% greater than with his conceptions. Then non-pregnant women contains plasma volume is 2600 ml, and plasma volume slowly increases at the end of the first trimester or after 3 months. Then it reaches a peak of 34 weeks. Then red blood cell production of RBC is stimulated and their numbers gradually rise. However, it compared to the expansion of plasma volume, and also RBC also increased in pregnancy time. Then protein, total serum protein gradually decreases along with the sharp decline in albumin. At the time of pregnancy, the albumin level declines. That's why the pedal edema arises in pregnant women. In total, serum proteins will decreases. Due to decreases of serum protein and also albumin level declines, that's why the pedal edema seen in the pregnant woman, and also hands and face also seen swelling. Then serum level of vitamin C, folic acid, vitamin B6, vitamin B12 follow the decline in serum albumin level. Then the pregnant woman requires the good level of vitamin C, folic acid, vitamin B6, vitamin B12, etc. Other nutrients are fat soluble vitamins concentrations, especially carotene and vitamin E are increased nearly 50%. Fat soluble vitamins are increased nearly 50% in case of pregnant women, and however remain unchanged. कौन है ना प्लाज्मा गोटे रहा जोटा कि 2600 ml नॉन प्रेग्नेंट वुमेन कर थाए, किंतु प्लाज्मा लेवल ऑफ प्रेग्नेंट वुमेन कर धीरे धीरे बढ़े आफ्टर 3 माने फर्स्ट ट्राइमेस्टर 3 मंथ्स, तापर से प्लाज्माटा बढ़ी 34 वीक्स जाए से रहे, तापर 40 वीक्स तो आमर कंप्लीशन ऑफ प्रेगनेंसी. देन रेड ब्लड सेल इंक्रीज इन द वॉल्यूम ऑफ रेड ब्लड सेल. तापर रहा प्रोटीन इन एट द टाइम ऑफ प्रेगनेंसी प्रोटीन रे कौन हुए ना डिक्लाइंस हुए, जहाँफल कि आल्बुमिन कमिला माने मदर्स पाद मुह हाथ सब स्वेलिंग्स आसे ड्यू टू द डिक्लाइंस इन द ऑफ द सेरम प्रोटीन और आल्बुमिन. तापर अदर न्यूट्रिएंट्स जोटा रहा तो फैट सॉल्युबल विटामिन, कैरोटीन, विटामिन ई आर इंक्रीज नियरली 50%, विटामिन ई एंड विटामिन ए इंक्रीज हुए, एंड अदर जोटा न्यूट्रिएंट्स रहिला तो सेटा हमर फॉलिक एसिड, विटामिन B6, विटामिन 2, B12 फॉलो द डिक्लाइन ऑफ एल्बुमिन लेवल. अदर न्यूट्रिएंट्स सच एज कैरोटीन, ई आर इंक्रीज इन 50%. ये सब जिनस एक्सपेंशन इन प्लाज्मा वॉल्यूम एंड आरबीसी मास. Then hormonal profile in pregnancy. What are the hormonal profile in pregnancy? Hormonal chronic HCG, when the human chronic gonadotropin begins to increase immediately on inflammation of ovum and reach the peak in the 8 weeks of the gestation. Then it declines in the stable value until birth. In the first 8 to 10 weeks, HCG maintains the corpus luteum, which is the main source of estrogen and progesterone in the early weeks of pregnancy. These hormones play an essential role in development of the placenta. These are the two hormones, estrogen and progesterone. These two hormones plays an important role in the development of the placenta. Then human placental lactogen with the structure similar to the growth hormone increases during pregnancy. During pregnancy, this human placental lactogen and its structure will and growth hormone will increases. Then placental lactogen stimulates lipolysis is the important maintaining a flow of substrate of the substrate of the fetus. Then placental lactogen along with prolactin it also promotes the development of mammary glands. Then other two hormones are there. One is placental lactogen along with prolactin, one type of hormone. It helps in development of mammary gland for milk secretion or breast milk secretion. After delivery, placental lactogen disappears from the maternal circulations. Estrogens and progestogens are secreted by the placenta from 8 to 10 weeks of gestation. At the times of gestation, 8 to 10 weeks, the estrogen and progestogen two hormones are secreted by the placenta. Then progestogen increases throughout the pregnancy. Progesterone increases throughout the pregnancy. It stimulates maternal respiration, ensures the adequate supply of oxygen to the fetus. Then it provides sufficient oxygen to the fetus. Then it relaxes smooth muscles in the uterus and also fetus and allow the child birth. Progesterone, which while stimulating labor development in the breast, inhibiting milk secretion during pregnancy. These two hormones plays a vital role at the time of pregnancy. One is estrogen and another one is progesterone. Then placental secretion of estrogen increases with progression of pregnancy, and then another hormone that is increased in maternal plasma during pregnancy is cortisol. Cortisol enhances production of glucose from amino acids by gluconeogenesis and also antagonizes the action of insulin. This way, it increases the availability of glucose to the fetus, which really solely to the glucose to the energy. Cortisol hormones provides glucose to the fetus and energy to the fetus in the marginally glucose intolerant women. These changes result of pregnancy may predispose them to frank impaired glucose intolerance. So three hormones are there, four hormones are there, two are estrogen and progesterone, then another one is prolactin, then third one is cortisol hormone. Other functions are dramatic changes occurs in renal functions, eliminate the nitrogenase and other waste product of maternal and fetal metabolism. Effective renal plasma flow and glomerular filtration rate increases by 50% in early pregnancy. In early pregnancy or in between first trimester, then the glomerular filtration of the kidney rates and increases in 50% in early pregnancy. These changes in renal function while helping to clear waste product on one hand. When the glomerular filtration rate will be increased in pregnancy in 50%, then the waste materials are excreted through our urine. Then associated with increased excretion of glucose and amino acids, but unrelated to the plasma level of these constituents. In addition, the heart and lungs respond suitably to the increased blood flow to the placenta and to increased demand for oxygen to the fetus. In addition, heart and lungs respond suitably to increase. The heart and lung functions are also increased to blood flow to the placenta, increase the oxygen level and is supplies to the fetus. तापर हार्ट एंड लंग फंक्शंस भी बहुत भल थाए ता सहित आमर किडनी फंक्शंस मध्य भल थाए कारण इन प्रेगनेंसी टाइम रे 50% आमर किडनी फंक्शंस करि थाए एज वेल एज हार्ट एंड लंग्स आल्सो वर्कड वेरी फर्स्ट देन नॉर्मल वुमेन. Then to the placenta, the increased demand of oxygen, etc. The intentional absorption of all nutrients is enhanced to take care of the increased requirement. Placental transport to the nutrients. The placenta is the transitory structure developing during pregnancy and lies implanted on the uterine walls. It is connected to the fetus through the umbilical cord. Placenta is connected with the fetus to the umbilical cord to the mother's body. The fetus derives all the nutrition and measure across the placental barrier. And the nutrients are delivered from the mother's body to the fetus with the help of the umbilical cord. Then the transfer of nutrients also depend on the concentration in maternal plasma and blood flow to the placenta, and the fat soluble vitamins and electrolytes are transferred by the simple diffusion. Glucose is transferred by facilitated diffusion, while amino acid, water soluble vitamins, minerals like calcium, iron are transferred by active transport. Role of placenta is promoting fetal nutrition. The role of placenta is very much important because through the placenta, it is the carrier of the nutrients to the from mother's body to the fetus. Role of placenta in fetal nutrition: nourishes the fetus, facilitates transfer of oxygen and nutrients from the mother to fetus. Placenta, role of placenta is very much important. It nourishes the fetus. How? Now it transfer the oxygen nutrients from the mother to fetus. Removes waste. Pick of fetal waste products such as uh, urea, bilirubin, and picks up the fetal waste such as carbonated urea and bilirubins. It remove the waste. Then fetal lungs, then performs the respiratory, absorptive and excretory functions that the fetus lungs, digestive system and kidneys will provide after birth. Fetal lungs also, it also perform the respiratory, absorptive, excretory function, excretion, respiration, etc. through the placenta. Then protective barrier protects the fetus from harmful agents such as high molecular weight, including proteins except maternal immunoglobulin G, and conferring immunity to the fetus. It is also a protective barrier, and it protects the fetus from harmful agent. Then endocrine gland transport nutrients from cases and store them. Endocrine gland produces several hormones that maintain pregnancy and prepare the mother's breast for lactation. Then from the endocrine gland, the milk secretion will enhances at the time of after childbirth. Then the placenta's role is to nourishes the fetus, remove the waste from the fetal bodies. Then fetal lungs and respiratory, then excretory and absorptive, etc. It enhances through the placenta. It is the protective barrier also. It protects the fetus from harmful agents. Then it helps in secrete. It helps in it helps the mothers to prepare the breast milk secretion for lactation. तो एटा हला रोल ऑफ प्लासेंटा रे बहुत रोल अच्छी कारण टोटल बेबी रो जहाँ भी फंक्शनल आमर जोटा फंक्शंस अच्छी तो थ्रू द प्लासेंटा मदर टू फिटस रो ए फंक्शनटा चले. देन मैटरनल वेट गेन, the often quoted figure that at the time of in the study, average weight gain by primigavida eating without any restriction was 12.5 kilo. This weight gain represents two major components: the production of conception and fetus, amniotic fluid and placenta. The the measurement total weight of the mother's maternal weight should be included with the product of the conception, the fetus, the amniotic fluid and the placenta. These all included and the weight will rises to 12.5 kilo. तो ये सब जिनस सब मिले फिटस को लेकिन amniotic fluid, placenta सब को मिक्स कला परे मदर्स 40 भितर 12.5 kilos increase हवा कथा. Then maternal tissues gained: expansion of blood, extracellular fluid, enlargement of uterus, mammary glands, maternal stores. Maternal stores means adipose tissues, etc. Twos are there: the product of conception, the fetus, amniotic fluid, placenta. Maternal tissue gained and expansion of blood and extracellular fluids are also increased. Enlargement of uterus, enlargement of mammary glands and adipose tissues. ये सब मिसला परे then it reaches to 12.5 kilo, 10 to 12.5 kilos. In India, several studies has examined that weight gain during pregnancy by women from upper and lower socio-economic group. While in the upper economic group, the average weight is 11 kilo. Then lower economic group women gain only 6 to 7 kg during pregnancy. ଯେମିତି कि ଯାହାର good financial those who have good economical condition was very good, they gains about 11 kilo, and who are belongs to lower economic groups, they gains to 6 to 7 kilo during their poverty or illiteracy or backward. Lower weight gain associated with increased risk of intrauterine growth retardation, perinatal mortality. Lower weight gain increase the risk of the fetus death, and it is usually useful to define certain terms here. जदि बहुत अंडर वेट है कि से 12.5 किलोज गेन न करी 6 to 7 किलोज गेन कला, देन बोथ मदर्स आर इन अंडर मालनरिश, तो से डेथ रेट आमर जो फिटल डेथ रेटा बढ़ी जाए. When the baby is born full term 39 to 40 weeks of gestation and weight less than 2.5 kilo, the baby is referred to as low birth weight. Low birth weight, how we will observe that the baby was in low birth weight. If the baby weight was less than 2.5 kilo, then we will refer as a low birth weight baby or a small rate of baby. These babies are suffered intrauterine growth retardation. Retardation is growth in utero. If the baby is born prior to full term and weight less than 2.5 kilo, it is not be classified as low birth weight or small for death. Such babies are premature baby or premature born. Nutritional needs during pregnancy. Then first one is energy. Two factors determine energy requirements: increase in mother's basal metabolism to support the work required for fetal growth and accessory tissues, and change in mother's usual physical activities. Mothers, according to mother's physical activities, fetal's growth, first nutrients is energy. Then estimated total cumulative additional cost of 55,000 kilocalorie works to be additional 300 kilocalorie per day in the last 2 trimester. In if you will leave the first trimester, then last 2 trimester we will add extra 300 kilocalorie per day as calorie. Then intakes for pregnancy. During the first trimester, the additional energy required is small, hence the RDA is not increased. First trimester due to the vomiting, due to the less appetite or lower appetite signs. That's why we should not add extra calorie in first trimester, and we will add rest 2 trimester as 300 kilocalorie extra. आम फर्स्ट ट्राइमेस्टर जेहेतु वॉमिटिंग हुए, अनइजी फील हुए, तो से एक्स्ट्रा कैलोरीज से नहीं पारे, तो नेक्स्ट जोटा टू कैलोरीज 2 ट्राइमेस्टर रे हम एक्स्ट्रा कैलोरीज ऐड करि परिबा, एक्स्ट्रा 300 किलो कैलोरीज ऐड करिबा. देन एनर्जी इज प्लस 300, प्रोटीन इज प्लस 25, but it is RDA is but we should follow the ICMR guidelines of 2020. Then fat 30, calcium 1000, iron 38, vitamin A 600, beta carotene 2400, etc. Then for the extra energy, cost of pregnancy is 85 kilocalorie per day to 85 kilocalorie per day extra, according to WHO 2004 recommendation. But we should follow the 2020 ICMR guidelines. The fetus can metabolize ketones, but its preferred sources energy is glucose. Adequate carbohydrate is needed to spare protein for growth. For growth of the fetus, it needs additional kilocalories or additional energy. Then the pregnant adolescent girls, underweight women, and women who are exceptional active much require more energy. Then pregnant adolescent girl, underweight women who are exceptionally very active, very doing very physical activities is his comes under heavy physical activity may require needs the more energy. मैंने जो मैंने ग्रोन अप स्टेज रे अच्छंती जेमती प्रेग्नेंट एडोलेसेंट अंडरवेट वुमेन्स जो ना कि हेवी वर्कर अंडर रे आसुचंती, जो माने हेवी वर्कआउट करूचंती, सेमानो को बहुत एनर्जी रो रिक्वायरमेंट अच्छी. Then in case of increased needs are discussed later, And energy status may be estimated by evaluating the rate of weight gain. If the rate of weight gain is appropriate for the stage of pregnancy, you assume that energy intake is adequate. Fasting is not recommended. Then we will go through protein. All together 925 gram of proteins are deposited in the normal fetus and the accessory tissues, and considering the dietary protein quality, per net protein unit is 65. An increase of 15 gram of protein per day is recommended. For according to the, if we will recommended any good quality protein to the pregnant woman, then protein must be in high strength, in high biological value rate, and net protein unit should be 65. The increase could be either through the vegetarian sources, pulses, soybean, milk and milk products, cheese, through the meat, fish, eggs in the diet, and this is based on the need of the non-pregnant woman plus the extra amount needed for growth. Physically active pregnant women, adolescent girl would, however, require more than the protein requirement because in case of pregnant women the fetus was developing or growing day by day. That's why the good biological protein is very much necessary. Then after except first trimester, then remaining two trimester it requires more than 15 gram of extra 15 gram of proteins per day. ମାନେ ଯେହେତୁ ଫିଟସଟା ଡେଭଲପମେଣ୍ଟ ପାଇଁ, ତ ସେଥିରେ ମଦର୍ସ ଡେଭଲପମେଣ୍ଟ ଆଉ ଫିଟସ୍ ଡେଭଲପମେଣ୍ଟ ଦୁଇ ଜଣଙ୍କ ପାଇଁ ତ ଆମର ପ୍ରୋଟିନ୍ର ରିକ୍ୱାରମେଣ୍ଟସ୍ ବହୁତ ଅଧିକା ଥାଏ। ତ ଯେତେବେଳେ ଫର୍ଷ୍ଟ ଟ୍ରାଇମିଷ୍ଟରକୁ ଛାଡ଼ିକି ରିମେନିଂ ଟ୍ରାଇମିଷ୍ଟର ଯେଉଁ ଦୁଇଟା ରହିଲା ସେଥିରେ ଏକ୍ସଟ୍ରା ଆମର ଯେତିକି ପ୍ରୋଟିନ୍ର ଆମର ଅଛି 55 to 60, then we will add extra 15 gram to the pregnant lady. The rate at which the calorie intake, then protein deficiency. The effect of protein deficiency during pregnancy are difficult to separate from the effect of caloric deficit, and intake is accompanied by limited energy intake and decrease the birth weight, and greater incidence of pre-eclampsia has been reported. So protein deficiency during pregnancy. During pregnancy, if protein deficiency occurs, then both mother and child are malnourished. We already known before. तो प्रोटीन डेफिशिएंसी रे आमे ताकू सेई भलिया प्लांट प्रोटीन्स, एनिमल प्रोटीन्स, गुड बायोलॉजिकल वैल्यू प्रोटीन जोटा दरकार, तो we should recommend to the pregnant woman. Then protein excess. It is not advisable to recommend protein supplements. Reports in literature indicate that high protein supplements are associated with increased incidence of prematurity and excessive neonatal death. If we will recommend more than the recommended amount to proteins amount to the pregnant woman, that may be neonatal death. Excessive neonatal death and will increase incidence of prematurity of the baby, and neonatal death also occurs. That's why we will give right amount of protein to the pregnant woman. Then micronutrients. The need for the vitamins and minerals is increased during pregnancy. Since the energy intake increases, the requirements of few micronutrients needed for energy utilization, thiamine, niacin, riboflavin, magnesium also increases. Since protein needs are higher, requirement of B6 and zinc also increase. Micronutrients involved in the growth and development of bone, connective tissues and synthesis of new cells are needed in greater amount. Micronutrients are very much important for growth and protections and development of bone, connective tissues, RBC, etc. That's why B vitamins, B6, all kinds of B vitamins, zinc, iron, folic acids, etc. are very much necessary for the pregnant woman. Then folic acids and vitamin B12 is very important. Folic acid and vitamin B12 are important for production of new cells of the baby. DNA must replicate and transmit in genetic formation of RNA. Then complicate the diagnosis of vitamin B12 deficiency. because we need to bear in mind that effect of high intake of folic acid are not well. Excess of everything, excess of every nutrient is very bad, and B12 deficiency can complicate the diagnosis of therefore the care should be taken to keep folate consumption under 1 mg per day. We should recommend the pregnant woman as 1 folic acid 1 mg per day. Then amount of folate present in the multivitamin form containing B12 should be sufficient. Folic acid and B12 is very much important. Then vitamins A, C, E, K. A, C, E, K are 4 vitamins, have specific functions, and a common role for all of them is to preserve the structural and functional properties of the cells. For structural and functional properties of the cell, we need A, vitamin C, vitamin E, and K. A, E, K are oil soluble, and C is water soluble or antioxidant. Then vitamin A requirement should be met through the diet. Also, if women of childbearing age intend using product containing high amount of vitamin A, they should be advised to consult the physician. Vitamin C deficiency has not been shown to affect the course of outcome of pregnancy. Mega doses of adversely infect metabolic dependency on high dose may develop in the infant, such as scurvy may rise in neonatal periods. If you will not sufficient amount of vitamin D at the time of pregnancy, then the infant such as scurvy may rise in neonatal period. Vitamin E needs are believed to increase during pregnancy, but deficiency in human locus E in the infants are correlated directly and maternal concentration. E is also necessary. It is also we will get from oil seeds and nuts, butter, ghee, etc. Maternal dietary deficiency of K is almost on hand, but transport across the placenta is low. Newborn often have low body level of vitamin K. So we should take medium amount of vitamin K. The need of vitamin A, C, E, K increase during pregnancy. Sometimes the deficiency of C, E, K are seldom seen, and A, C, E, K. K is the role of K is expansion and contraction of muscles and movement of the baby. For the good movement of the baby, we should recommend vitamin K rich food to the pregnant woman. Karana K ର functions ହେଲା it contracts and expansions of the any muscular any muscles of her body. That's why vitamin K helps us to movement of the fetus movement and baby movement. That's why K is also important. Mineral requirements is iron, while vitamin B12 and folic acid needed for the normal arthropoiesis and may be accompanied by the adequate amount of other nutrients. Iron we need normal weight infant has about 246 mg of iron in blood and body stores. An additional 134 mg stored in the placenta and about 290 mg to expand the volume of mother's blood. When we will take iron and while vitamin B12 and folic acids needed for normal arthropoiesis, which means it contains it's stored in 246 mg of iron and blood and body stores in a normal weight infant. In a normal weight infant's infant's body stores 246 mg of iron in blood and body stores. An additional 134 mg stored in the placenta and about 290 mg used to expand the volume of mother's blood. So it is the total amount reserved or stored in the body of the fetus as well as maternal. Maintenance of माने इटा हला iron रो जो level तो सेटा हमरो किछि placenta रे store हेछि किछि infants रो blood रे आउ किछि expand the volume of mother's blood. तो ये सब मिसे कि हमर एति कि iron B12 and folic acid is required for a mothers at the time of pregnancy. Then maintenance of erythropoiesis is one of the few instances during pregnancy when fetus act as a two parasites. It ensures its own production of hemoglobin, drawing iron from the mother. Everything the baby draws out from the mother's nutrients, oxygen, etc. through the placenta. If sufficient iron is available, the mother's hemoglobin level should be 11.5 gram to 17 gram. 11.5 gram in 100 ml by turn. 100 ml in 100 ml blood, then in contains 11.5 mg of hemoglobin level. Insufficient iron is available. Most women are not able to meet the additional. ମାନେ ଆମେ ଯଦି ହେମୋଗ୍ଲୋବିନ୍ ରେଟ୍ ଚେକ୍ କରିବା ତେବେ ଯଦି 11.5 ଏଭବ୍ ରହିଲା ବା 11.5 ହଉ କି ତାଠୁ ଏଭବ୍ ରହିଲା ତେବେ ଆମେ ଜାଣିବା ଆଇରନ୍ ଲେଭେଲ୍ ଇଜ୍ very much good. Availability of iron level in the mothers is very good. Most women are not able to meet the additional requirement from iron and diet alone, and ingested is less, especially in lower income setting, and bioavailability, efficiency absorption is low. So lots of women were not meet to able the additional requirements of the iron कारण समस्तଙ୍କର 11.5 या समस्तଙ୍କର ସେଇ requirements fulfill ହେଇପାରି ନଥାଏ due to the low absorption ଗୋଟେ ରହେ ଆଉ ଗୋଟେ bioavailability ମାନେ ସେତିକି available ତାଙ୍କୁ evidence form ରେ ମିଳେନି कि ତାଙ୍କର ବଡିରେ ସେତିକି absorb ହେଇପାରେନି कि ଯାହାକୁ iron absorb କଲା वाला जो nutrients ଅଛି ସେତିକି ବି ମିଳେନି. That's why they were goes to iron deficiency by anemia. Thus, it recommended that pregnant women receive an oral iron supplement 60 to 100 mg. In these cases, if the nutrients are unavailable, that's why they will take oral iron supplements 60 to 100 mg. Iron should be maintained hemoglobin level in normal pregnant women. That's why they will mix with nutrients in according to nutrition, and they should add oral iron supplements of 60 to 100 mg iron to maintain the hemoglobin level. Hemoglobin level को maintain करिया कोले जो माने nutrition through रे एतेटा पाई पारु नहंती कि बॉडी तांकर सेतिके absorb करि पारुनी, then they should go for extra oral iron supplements. Then calcium. Calcium fetus retains about 25 to 30 gram of calcium over the course of gestation, most of which are deposited in the last trimester when the fetal skeleton is growing rapidly and teeth are forming, etc. On the average, the fetus draws 250 to 100 mg of iron, calcium per day from maternal body supply. The fetus retain about 25 to 30 gram of calcium over the gestation period of 40 weeks of pregnancy. The fetus retains 25 to 30 gram of calcium when because the fetal skeleton is growing rapidly, teeth are forming, etc. On average, fetus will draw 250 to 300 mg calcium from her mother's body. Additional calcium is believed to be stored in the maternal skeleton as reserve for lactation, and additional calcium is stored in the mother skeleton to reserve for at the time of in the lactation period the calcium will be utilized. कारण maternal skeleton रे reserve है कि किछि calcium मध्ये रहे किछि माने हमरो बेबीर बॉडी को बा फिटस रो बॉडी को ट्रांसफर हैला तांकर टीथ फॉर्मिंग पई तांकर बोन फॉर्मिंग पई फॉर्मेशन पई सेटा हैला प्लस आउ किछि स्टोर हे कि रहिला फॉर द नेक्स्ट पीरियड ऑफ लैक्टेशन पई. So additional calcium is very much necessary here. So intake of additional 500 mg is recommended during both pregnancy and lactation. So additional 500 extra mg of calcium is necessary. Additional of 15 gram of protein is necessary. Extra calcium is necessary. Iron, folic acid, B12, their extra additionals are also necessary. Extensive adjustment is calcium metabolism occur. Efficiency of calcium absorption is better and urinary losses power in pregnancy compared to the non-pregnant state. Then Along with calcium and phosphorus, adequate vitamin D is also required. So, with good quality of calcium and phosphorus, adequate vitamin D is also required for absorption of calcium and phosphorus. Then zinc. Zinc as a mineral was found to be associated with fetal growth and birth weight. Zinc plays an important role in fetal growth and birth weight. Low plasma zinc was associated with more complication in antenatal and intrapartum periods during pregnancy-induced hypertension. Subhormonal tissues, zinc is pregnancy may play in role in premature ruptures of membrane at term. Uh, A point of caution is interaction between zinc and iron. Zinc absorption is inhibited in iron intake. Thus, iron supplements may in zinc status, such as zinc is very much necessary for a pregnant woman for role in premature rupture of membrane at term at the time of pregnancy. It plays a role in premature ruptures of membranes of the fetus. Then point of then iodine. Iodine is maternal iodine deficiency lead to cretinism or offsprings. Cretinism means it helps in development of the brain development and also all kind of development we need iodine. Then mothers, we should recommend the mothers or pregnant women as a good proportion of iodine. That's why it leads to cretinism of the offspring. And the maternal diet must consist of enough iodine so as to prevent the consequences of fetal damage and also for brain development, for others development of the fetus. The pregnant women should take good quantity of iodine. Then other one is trace element minerals are chromium 67 mcg, copper 2.2 mg, manganese 5.5 mg, zinc 15.5 mcg, iodine also 150 mcg. Then sodium. Sodium plays a role in fluid balance. Sodium metabolism is altered during pregnancy under the stimulus of the modified hormonal milieu. Then restriction of sodium is not recommended to combat edema. In animal, it has been shown that weight such animals shows reduced weight gain, altered fluid consumption patterns, and neonatal hyponatremia has been observed in offspring of women who unduly restricted their sodium intake before delivery. The use of sodium rich food may be appropriate, aggressive restriction is not warranted. And then we should recommend sodium up to 2 to 3 gram of sodium may be consumed daily for fluid balance. Management of high risk pregnancy or anemia in pregnancy, hypertensive disorder of pregnancy, then pregnancy in diabetes mellitus, pregnancy and obesity, adolescent pregnancy. These are the risk factors of pregnancy. The main cause being dietary iron deficiency, which may date back for pre-pregnancy years, acute blood loss caused by hemorrhages in related cases, folate deficiency, which is less common, and result in megaloblastic anemia, and occurs in the iron deficiency. Anemia caused by both factors is less common. In pregnancy, anemia is most common. Then how we should control anemia in pregnancy. Now we should give iron rich food with vitamin C rich food. and folic acids and vitamin 2 B12. Then hypertension disorder of pregnancy. Hypertension has been existing before pregnancy. Then the symptoms: hypertension, proteinuria, and edema, which occur after 20th week of pregnancy. After 20th week of pregnancy, the pedal edema seen, पाद फुली जाए. Then may be signal of unusual weight gain within a few days. Studies that higher in younger mother and those who have pre-existing vascular disease and essential hypertension, type 2, type 1 diabetes and several diseases. तो आमर 20 वीक्स पर सेमती भी नॉर्मली आमर पाद स्वेलिंग आसे कारण केतले आमर ब्लड प्रेशरटा अंडर कंट्रोल रुहे बा केतले हाई रुहे ड्यू टू द वाटर रिटेंशन इन आवर बॉडी. Sodium intake can be 2.3 grams since dietary sodium intake should be moderate and sodium restriction should not cure the syndrome. I mean sodium restriction कले भी सेटा swelling टा जाएनी. Maintenance of good nutritional status is important. We should recommended good proteins and albumin rich food. Mother should be aware and careful since PIH has caused convulsion and proved to be life threatening. ସେଥିପାଇଁ କି ଆମେ सोडियम आधे किसी भूमिका नहीं कारण इफ यू विल गिव लेस सॉल्ट टू द प्रेग्नेंट वुमेन देन should be moderate but sodium restriction does not cure the syndrome. से syndrome टा sodium restriction रे हुए नहीं but we will give good nutritional status but good nutrition to the pregnant women. आमे ताको भला nutrition देले से जो swelling टा रुहे कि आमे सोडियम रेस्ट्रिक्शन माने मोर देन सोडियम बेसी सोडियम रिच भी खाइबानी कि सोडियम जेति के आवश्यक 2 to 3 ग्राम्स नॉट लेस देन 2 to 3 ग्राम्स आमे तांको रेकमेंड करिबानी. ता सहित आमे तांको गुड बायोलॉजिकल वैल्यू रो जो एल्बुमिनटा देले मे बी सेटा टिके ये ही पारे कि 20 वीक्स परे ई स्वेलिंग आसे. Pregnancy and diabetes mellitus. During pregnancy, woman has pre-existing chronic disease requires special cures, and diabetes developed during pregnancy termed as gestational diabetes. We will call as gestational diabetes, and in this control the blood glucose level. We will give simple carbohydrate. We should stop giving simple carbohydrate to the pregnant woman. Instead of we should recommend it simple carbohydrate such as sugar, jaggery, honey. We should restrict this kind of simple sugars to the pregnant woman. Then patient's education, intensive management of glycemic control can help the mother to have healthy pregnancy. So low glycemic rich food. We should give low glycemic rich food to the pregnant woman and to have healthy pregnancy and healthy baby and reduce the risk of complication. To reduce the risk of complications, we should recommend good complex carbohydrate instead of simple carbohydrate. Pregnancy and obesity. Obesity associated with increased risk of gestational diabetes. Obesity increase the risk of gestational diabetes, hypertension, preeclampsia, then perinatal mortality, and need for induced labor and lower birth weights are acceptable for overweight women. So overweight women are she gives the underweight child. Then and study have shown that obese mother have the best pregnancy outcomes. They gain approximately 6 to 7 kg during pregnancy. If the pregnant woman is overweight, then the weight in 40 weeks, the weight should be increased to 6 to 7 kilo, is safe to the mother and baby. And if he is normal weight, she will her weight will increase to 12.5 kg in 40 weeks. So adolescent pregnancy is very high risk patients. The pregnant adolescent is viewed as a very high risk, and the competition between maternal and fetal needs places both mother and infant at a risk, in very risk. Frequency of prenatal problems, toxemia, anemia, premature birth, low birth weight, increased maternal neonatal mortality is higher. In case of adolescent girl less than 18 years, if she will conceive a baby, then lots of complications are seen, such as low birth weight, increased maternal and neonatal mortality is increased, anemia, toxemia, prolonged labor reflects the mother's physical immaturity. Growth usually continues for fourth year post-menarche and so during puberty. Thus, nutritional need for an adolescent mother must be estimated. She needs more nutrients than a matured pregnant woman. In addition to a need for growth, the dietary intake must meet the requirement of pregnancy, and the nutritional requirements can be estimated by summing RDI for the specific age and recommendation. Then, expected weight increases as a result of normal growth during 9 months of pregnancy, and the girls during the first year after menarche at almost 10 kilo 4 years after menarche. Increase in required for support pregnancy. If underweight, the increase need to be achieved average weight for height. Then it requires more nutrients, more nutritional rich food in comparison to adult pregnant women. Then lactation. Lactation is a physiologic process which has profound relevance of both the mother and newborn. And when the mother nourishes a fully developed and a rapidly growing baby with breast milk, breast milk, a lactating mother secretes about 500 ml milk per day in a fast month. A lactating mother secretes 500 ml per day in a fast month. Fast month of lactation, she secretes only 500 ml of milk per day, which increases about 850 ml per day by the fifth month. By the fifth month, it should increase about 850 extra ml per day in the fifth month. On the average, a well-nourished lactating woman secretes about 850 ml per day. And at last, on the average, it will secrete 850 ml per day. We need a understand and establishment and maintenance of lactation if you want to help mother with proper and effective lactation management. During pregnancy, change occur in the mother's breast to prepare milk production, as well as body fat are deposited to ensure the energy is available in lactation, and the anatomical structure of mammary gland and adequate development alveoli, ducts and nipples, initiation, maintenance of milk secretion, ejection of milk, etc. are increased and enhanced. Then human milk composition and infant growth and development. Composition of human milk of energy. In 100 ml of milk, it contains calories 65, protein 1.1, carbohydrate 7.4, fats 3.4, and calcium 28, beta carotene 137, thiamine, riboflavin, niacin is not there, vitamin C 3. Then it is the milk compositions varies between mothers and lactation of the time. The calorific value of human milk depends mainly on the fat contents. Even after prolonged lactation for 2 years or more, the quality of milk produced by Indian and African women to well maintained and quality of the same. So it contains highly complex mixture of organic inorganic compounds. Human milk is a solution of protein, sugar, and organic and compounds in which a variety of fatty acids are suspended. Volume, then first day of milk is known as colostrum, and 2 to 10 ml feeding per day relating part of the priority of the mother. It is yellow due to relatively high carotene content. That's why the colostrum color is seems yellow in color. Transparent contain more protein, less sugar and much less fat. Less fats and less sugar and more quality and quantity of protein is there in transparent milk. In lower in calories than matured milk. Concentration of sodium, potassium and chloride greater than in mature milk. Facilitates establishment of bifidobacteria in the gastrointestinal tract of newborn. Facilitates passage of meconium in the newborn's intestine. Abundant content of antibodies are there in a human woman's milk. It contains first day milk, it is known as colostrum or yellowish colors of milk. It contains higher amount of carotene, and it is also known as it is the antibodies to the student, it is the antibodies to the fetus or child. Then the second one is transparent, contain more protein, less sugar and less fat. And it contains mother's milk contain abundant form of antibodies. Diet and feeding pattern of feeding of 0 to 6 months infant. The term exclusive breastfeeding is used when all fluids, energy, nutrients are provided by breast milk, and the breastfeeding means not even water is given at the time of breastfeeding. Nothing was recommended to the child. No water and no other liquid items are there. In milk provides enough water even in hot summer month. In hot summer month, to prevent dehydration, milk is enough for the baby. से टाइम रे कौन से प्रकार पानी रो आवश्यकता, डिहाइड्रेशन हेले कि लूज मोशन हेले जहाँ भी हेले, नो नीड ऑफ एनी वाटर, द ब्रेस्ट मिल्क इज एनफ फॉर द बेबी. Then advantages of breast milk is simple and natural method of feeding, and exclusive breastfeeding till 6 months ensure normal growth and development. Nutritionally, breast milk has advantages: first, low in protein and high in lactose content than other milk. Then colostrum is rich in nutrients and anti-infective factors. Colostrum is secreted in fast 2 to 3 days. Fast 2 to 3 days, the milk is known as colostrum, and it is slight yellowish liquid color. And the child against various infections, it develops natural immunity in the child's body to protect from various infections. Besides antibodies, rich in nutrients, and it has also a laxative effect also, and tones guards for movement. Diseases and death among breastfed infant is much lower than formula fed on infant. Breastfeeding protect against diseases such as diarrhea, upper respiratory tract infections. Then cow's milk contain lactoglobulins and serum bovine albumin, which may cause allergy to some infants. That's why cow's milks are not recommended till the baby is not reached to 1 year of age. Breastfeeding establishes mother's infant contact and promote mother-child bonding. Then it prolongs the birth interval by fertility control. It prolongs the breastfeeding controls the birth intervals by fertility control. Then in addition to nutrients and anti-infective factors. Mother should be maintain hygiene. Mother should maintain a correct posture. The infant should exclusively breastfeed till 6 months of age. These are the guidelines for breastfeeding. Mother herself should be avoid tobacco, alcohol, consumptions of drugs during lactation. Mother should not breastfeed in case of breast abscess or cracked nipples, fevers, anemia, tuberculosis, etc. Mother should stop feeding to the child. Then, infant should be exclusively breastfed till 6 months, and complete immunization should be enforced even the child has fever, restlessness, etc. After immunization, breastfeed should continue. At the time of immunization, stop breastfeeding, and after immunization, breastfeeding should continue. Breastfeeding should continue even if there is diarrhea. In case of diarrhea, any other diseases, then breastfeeding should not be stopped because it contains antibodies. Then after 6 months, whenever the baby is fed on animal milk, supplements of iron and vitamins to be provided. Animal milk does not have this in adequate amount. Heat-treated milk formula may be fortified. In many cases, if the infants have doubled their birth weight and solid foods are cereal-based supplemented with vitamin C or iron in 6 months. When the baby reaches in 6 months on her age, 6 months ହେଇଗଲେ so including breast milk we should give some supplementary feeding to the baby. It should contain supplemented with vitamin C or iron is introduced around 6 months. Around 6 months we should give vitamin C or iron to the baby. Usually cereal is rice, which is known as very low in allergic. Rice contains rice is an anti-allergic food. Needless to say that weaning of breast around 6 months is driven more due to circumstances than need of the infant. The other food liquids are provided along with breast milk is considered complementary feeding. Any nutrient containing food or liquids other than breast milk given to the young child is known as complementary food. Complementary feed means when the baby is in breastfeeding, and we should add other nutrients to balance the uh, for the balanced nutrients we should add some other nutrients to the baby. The breast milk breast milk is not sufficient after 6 months of the age. That's why we should add some other extra nutrients to the baby. Other than breast milk, it is known as complementary feed. The nutrients containing food or liquid other than breast milk, complementary feeding. Then feeding for 6 to 12 months infants. What we will feed the infants at the age of 6 to 12 months. As the infant grows older, mother's milk alone is not sufficient to meet his increasing need. That's why infant between 4 to 6 months by the downward slope in the growth curve. Then weaning is a process gradually introducing food other than breast milk. Then the infant is 6 to 12 months can eat daily diet 30 to 45 gram of cereals, 15 gram pulses, 200 to 500 ml of animal milk. Animal milk, if breastfed, then 200 ml of top milk is recommended. 50 gram roots and tubers, 25 gram green leafy vegetables, 25 gram other vegetables are there, and 100 gram fruits, 25 gram sugar, 10 gram fats. Adding extra fat in dal khichdi is a recommended practice to ensure infant growth and decrease in bulk in diet. Then rice is a anti-allergic food. Rice रे कौन से प्रकार allergic हुए नहीं. We should add some pulses of dal. Then vegetables. We should add extra ghee or fats to the in the baby's feeding for balanced diet for infants. Introduce only one food at a time, giving only small amount at first. Increase variety slowly. Slowly we should increase the variety of the food. Introduce all food groups. Give an extra dish of Dash of fats in 1 or 2 items. Do not use excessive fat, salt and sugar. We should not add excessive salt, sugar and fats to the baby's feeding. It causes dysentery and diarrhea and vomiting. And do not then prepare bland and non-flavored items. Consistency should be gradually built from liquid to semi-solid. We should build first. Breast milk is liquid, then we should develop, or we should increase the liquid to semi solid consistency. आमे liquid to semi solid अर्ध तरल भलिया आमे ताको चेंज करिबा. Particle size of gruels should be built gradually from homogeneous khichdi as well as mass to thick khichdi. Then we will prepare semi-liquid khichdi. Then we will go for thick khichdi. Quantity should be gradually, slowly we should increase the quantity. If the child dislikes or disinterested, discontinue the food for some time and reintroduce later. If the child is the child not wants to eat this kind of food, then stop there, then again start after some time. Identify intolerance and immediate discontinue. Cow's milk, egg white, soya bean, etc. are allergic content food. And if the identify of intolerance, if it is intolerance, lactose intolerance, it is egg intolerance or soybean intolerance, then stop giving this food to child. जदि ताको किछि सूट करूनी बा सेथरे वॉमिटिंग होउची, किछि स्किन रैशेस आसुची बा लूज मोशन हो जाउची, then we will stop giving this kind of food. Avoid fiber. Whole legumes, raw vegetables with their high fiber content are food recommended for adults but not for infants. Infants cannot digest the fibrous food, and it is good for adults person. Therefore, stop giving high fiber food to the infants. Some complementary foods need special preparation such as ARF and mashed potato or banana. It is possible to feed from family pot, mashed dals, etc. etc. Here one chart is there, table is there, 14.9, 4 to 6 months child. We should give fruit juices mixed with little sugar, etc. Feeding schedule in infancy: milk feed 5 to 6 times a day and continue breastfeeding. Exclusive breastfeeding up to 6 months even during illness. During illness we should continue our breastfeeding in between birth to 6 months. Then in 6 months start complementary feeding. Feed 3 to 4 times per day. Porridge, dal, vegetable, fruits, etc. 6 to 9 months continue breastfeeding, and 9 to 12 months continue breastfeeding and feed 5 to 6 times per day. In 6 to 9 months we should start 4 to 5 times per day. Then feeding for preschooler. Preschoolers are cereals and millets 1 to 3 years 120 gram, pulses 30 gram, milk 500 gram, roots and tubers 50 gram, green leafy vegetable 50 grams, other vegetables 50 grams, fruits 100 grams, sugar 25 grams, visible fats 20 grams. For many children under 5 and particularly those under 3 years of age who lives in this condition, sick, diarrhea, respiratory infection is a part of normal life. Then lead to chronic and mild wasting is also in preschooler child. In preschool stage, malnutrition is seen. By malnutrition टा preschooler ages रे ही देखा जाए थे. तो ये टाइम रे हमें ताको proper nutrition दरकार. तो 6 to 7 cm year in the height and 1.5 to 3 kg per year in a weight. Preschooler child ro growth chart ta jota growth occurs in spots should grow 6 to 7 cm per year in height and 1.5 to 3 kg per year in a weight. जदि एथरे तांकर एतिकी ग्रोथ रो डेवलपमेंट न होला, she or he should comes under malnutrition. Children below age of 5 years should be give less bulky food, but rich in energy and protein, but cereal pulse combinations, legumes, pulses, egg, meats, etc. High quality protein, good quality protein, cereals, roots and tubers, fruits and vegetables, fats, etc. Give recommended to the preschool child. Nutritional programs targeting infants and preschoolers. Integrated Child Development Scheme, ICDS scheme, Vitamin A Deficiency, VAD scheme, Immunization Program, National Nutritional Anemia Prophylaxis Program. These are the national nutritional programs for infants and preschoolers. Preschooler childs are comes under under 5 years of age. Under integrated ICDS, the preschooler receive food supplements, nutrition and immunization. In ICDS scheme, the children's are receive food supplement, then immunization and food supplements, immunization and nutrition. Vitamin A deficiency in a public health problem among preschoolers. Then prophylactic doses of 1 lakh international unit is given at 9 months along with measles vaccine and others. All kind of immunization given to the preschool child with proper nutrition and food supplements. Then in National Nutrition Anemia Prophylaxis Program addresses iron and folic deficiency anemia. Preschooler receive 20 mg iron and 100 microgram folic acid daily. Then deworming of preschool is advised. Preschool children have one of the target group of receive iron folic acid tablets under National Anemia Prophylaxis Program. But in iron in National Anemia Prophylaxis Program, the iron and folic acid tablets are distributed among children who are under nutrition, who are in anemic stage. They were um, they receive iron folic acid tablet in this prophylaxis program. ये जो prophylaxis program रे iron folic acid tablets 20 mg रो iron 100 mg रो folic acid so preschool child को distribute करा जाए. Then in it's also iron folic tablet contain 100 mg elemental iron and 500 mg amount of folic acid given to the pregnant and lactating women for 100 days. For 100 days pregnant और lactation को iron folic acid दिया जाए and as well as the preschool child मानों को मध्य दिया जाए under the National Nutrition Anemia Prophylaxis Program. The diarrheal management strategy have had a major impact on less than 5 mortality rate, and National Nutrition Mission has been announced to bring rapid reduction in undernutrition, elimination of micronutrients deficiency, and iron, iodine, and vitamin A deficiency. In Anganwadis, National Nutrition Mission पाइंकी तो बहुत बड़ा जंती cereal mix छतुआ laddus, egg, soybeans, khichidis, etc. distributed to the children through 6 to 36 month of age from the Anganwadis. Nutrition education by Anganwadis workers and ANM are promoted. The problems of infants and preschoolers nutrition. Problems and infants of preschooler nutrition are diarrhea, low birth weight infants, undernutrition, etc. Diarrhea due to lactose intolerance and milk protein allergics may require switching of to soya-based or lactose-free formula. If the patients are unable to tolerate lactose or milk proteins, then instead of milk protein, we should provide soya proteins to the children at cases of the diarrhea. Then low birth weight infants, 1/3 of the babies in low birth weight less than 2.5 kilo. Then they are the at the age advances there is catch up or rapid weight gain there are high chances of obesity and diabetes. In these cases, in low birth weight cases, we should breastfeed the child for 6 months and providing iron supplements by iron tablets or iron drops to the infants have poor iron stores at the birth, and all immunization should be given. For underweight baby, we should provide iron drops to the child, proper immunization, and 6 month breastfeeding. Then, undernutrition or chronic energy deficiency are extended period of inadequate food intake, poor dietary quality, increased morbidity, and combination of these factors. In cases of undernutrition, we should give food supplements to the child. Then increases the awareness among mothers to give proper nutrition to the child. With the undernutrition cases, first we should educate the mother to take right quantity of proteins and energy. Then nutrition education through all modes by Anganwadis. Good morning. Nutrition education through all modes, especially by Anganwadis workers and ANMs, to promote universal breastfeeding and exclusively, for example, Montes, which can continue till 24. Food for fiber child, child. And vitamin prophylaxis doses are 18, 24, 30, 36 months by Anganwadis. Organize immunization on a fixed date at least once a month. Immunization is there. Food nutrition supplements are there. Anganwadi workers gives iron folic acid tablets, ORS packet to the child. Promote universal use of iodized salts. You should promote to take iodized salt in their food. Then 0 to 6 years to be vetted 4 times in a year, and grade 3 and grade 4 identified to get double ratios at home food supplements. Weight all pregnant and lactating women and identify those who less than 40 kilo and provide them food grains. They should they should observe their weight and height, and if they observe that she or child will comes under in underweight, then she will provide weighs and at least less than 30 kilo get food grains to the persons, adolescent girl, child, or pregnant or lactating mother. Organize child health clinic at Anganwadi to screen for anemia, vitamin A deficiency, iron deficiency. ताମାନେ ଏଇ ସବୁ କେସେସ୍ ନ୍ୟୁଟ୍ରିସନ୍ ଏଜୁକେସନ୍ ପ୍ରୋଗ୍ରାମ୍ ଆୱାରନେସ୍ କରିବା, ସପ୍ଲିମେଣ୍ଟସ୍ ଦେବା, ତାଙ୍କର ହାଇଟ୍ ୱେଟ୍ ଚେକ୍ କରିବା, ଇଫ୍ ଦେ ଆର୍ କମ୍ସ ଅଣ୍ଡରୱେଟ୍, ଯଦି ଅଣ୍ଡରୱେଟ୍ରେ ସେମାନେ ଆସୁଛନ୍ତି ତାଙ୍କୁ ଫୁଡ୍ ଗ୍ରେନ୍ସ ପ୍ରୋଭାଇଡ଼ କରିବା, ଇମ୍ୟୁନାଇଜେସନ୍ କରିବା, ଏକ୍ସେଟ୍ରା. Overnutrition and obesity. An infant is never put on a reducing diet. The chances of obesity are at least if the infant is exclusively breastfed till 6 months. Overnutrition by obesity. The infant is never put on a reducing diet if the chances of obesity are least and the infant is exclusively breastfed for 6 months. 6 months breastfeeding is compulsory, and 6 to 12 months exclusive feeding of the fat and sugar can be lead to the growth and curve. When we will start the complementary feeding, we should restrict the amount of fats and sugar, and salt in the complementary feeding of the baby. If the family history of dyslipidemias, heart disease are there, children should not be screened and treated accordingly. If their family histories were there, is their family histories of high cholesterol and heart disease were there, then we should restrict the baby from salt, sugar, and fats. Nutrient deficiency disorders are protein energy malnutrition (PEM), iron deficiency anemia, vitamin A deficiency are still the major public health problem affecting large number of preschoolers in our country. In our country, large of preschooler means 0 to 5 years age are malnourished in India, in our country. That's why protein energy malnutrition we should educate the mothers, child's mothers as well as the child to take good quality of calories and proteins as well as vitamin minerals in her diet. Then elderly nutritional requirement and dietary modification in the diet of the elderly person. What is the recommended dietary for the elderly person? We should give medium calories to the elderly person, and vitamin B6 and B12 is important, or folic acids give protection against elevations of homocysteine and the independent risk factor of cardiovascular disease. For controlling of cardiovascular disease, hypercholesteremia, etc., depression, certain deficient of neurocognitive functions, we should give vitamin B6 and vitamin B12 to the elderly person. Then, a good nutritional status of vitamin C, E, and beta carotene by antioxidant may, among healthy elderly, have shown a reduced risk of cancer, cataract, and heart disease. We should recommend we should recommend it we should recommend vitamin C, E, and beta carotene by A to the elderly person to reduce the risk of cancer, cataracts, and heart disease. Then nutrients act as modulators of chronic disease risk. Therefore, it is more important for the elderly to consume a diet rich in antioxidant nutrients. Vitamin A, C, and E, and selenium is very much important for chronic disease, risks of chronic disease. How we should control the chronic disease? Then we should take vitamin A, C, and E, and selenium. And vitamin B vitamins are folic acid, vitamin B6, and B12, and minerals like calcium and prevent chronic diseases. To prevent chronic diseases rather than consuming just amount of everything. Then it is most important is B vitamin, folic acid, B6, B12, and vitamin A, C, E, and selenium, and beta carotene. Dietary modification in the diet of the elderly. Due to the restriction in calories, we should restrict the more calories. Nutrient dense food should be included in the menu. Small frequent meals should be easy to prepare and digest. Small frequent meals should be advised to the elderly person due to the lower digestibility capacity. तो तांकर डाइजेशन रे बहुत प्रॉब्लम थे, माने डाइजेशन भलरे हेई पारेनी, एब्जॉर्प्शन एंड डाइजेशन आर वेरी लोअर इन एल्डरली पर्सन. दैट्स व्हाई वी शुड एडवाइज देम टू टेक स्मॉल एंड फ्रीक्वेंट मील्स. The taste acquisition and sensation of smell decline in later age, and they also loses their sensation of smell, and taste also. It should be more attractive and palatable. It should be attractive and in soft form. Then loss of teeth due to increased decay of teeth. Gum is common in aged person. So chewing is difficulty, and we should care must be given to avoid too much carbohydrate rich food. Include food that provide nutrients such as vitamin, protein, and minerals like calcium. Then instead of giving lots of calories, we should give vitamins, proteins, and minerals like calcium. There is decreased secretion of saliva, which makes swallowing difficult. Therefore, we should advise to soup, vegetables, and gravies, liquid items in their diet. Curds, raitas, dals included in the meals, and very dry meals should be avoided due to less secretion of saliva. Then gastric acidity decreases in the last percentage of old person. Peptic, tripeptic, amyloidic, lipolytic activities in the digestive secretion are decreases. That's why we should roughages in the form of tender vegetables and fruits is beneficial against problems of constipation. Uh, in these cases, reduced acid secretion, muscle weakness lead to delayed esophageal emptying, food intolerance, etc. Take intake of fiber and fluid with combination of fluids and fiber. We should advise the elderly person you take fibers as well as with fluids daily, at least 8 glasses of water of non-alcoholic caffeine free beverages. They should take fluid intake up to 8 to 10 glasses with fiber contents food. Roughage in the form of tender vegetables, fruits, beneficial against the problem of constipation. They in elderly persons, constipation also increases is the major factors in elderly persons. That's why we should advise to take tender vegetables and fruits as well as take a prudent amount of or more amount of fluids in a diet. Then protective foods and vegetables must be included in the diet of elderly. Every effort must be made in order to incorporate this in the daily diet. Impaired absorption of iron and calcium may occur because of hypercholesterol, decrease stomach due to the decrease in stomach acidity. Then iron and calciums are not absorbed properly. That's why osteoporosis are seen. In elderly person, osteoporosis are seen. So iron and calcium rich foodstuffs should be included in the daily dietary intake. Due to less absorption of iron and calcium, due to decreased stomach acidity, they are unable to absorb. Their body are unable to absorb iron and calcium. So we should include more iron and calcium rich food stuff in their daily dietary intake. Elderly people also have to make a conscious effect of drinking water in order to remain well hydrated, especially in warm climate. Elder persons elder person body was dehydrated due to their old age. That's why we should uh, recommend to the elderly person to take sufficient amount of drinking water in order to remain well hydrated in warm climate. In summer season, we should we should advise the elderly person to take more fluids to avoid dehydration. Small frequent meals should be advised there. Iron, zinc, antioxidant nutrients, all kinds of B vitamins, C vitamins are advised to the elderly person. The likes, dislikes, and food preference of the elderly should be considered while meal planning. Among elderly who suffer from chronic diseases like diabetes, hypertension, and heart disease, further dietary modifications may be required. If any other chronic diseases are there, diabetes, hypertension, cardiac problems, then we should advise diet according to their disease conditions. Chopped, grind, and mechanical blend food and hard to chew. Milk as beverages. Paneer, cottage cheese is also good for elderly person. Egg, soft cooked and scrambled eggs are there. Tender meat or poultry. Fine minced or ground. Soft cooked fish is also good. Soft raw fruits like banana, papaya, mango. Pulpy fruits are also good for elderly person. Cooked apples, pears, fruit juices, pineapple, lime, and oranges. Soft cooked vegetables, chopped or mashed. Raw vegetables such as tomatoes can be eaten. If fine chopped and the skin removed, soups can be given. Cooked rice, suji kheer, upma, poha, vermicelli, etc. Soft cooked foods are very much good for a elderly person. plain bread or toast, hot milk is a good dessert. What is sports nutrition? Sports nutrition is a discipline which applies principles derived not only from nutritional but also biochemical and physiological scientific knowledge for the purpose of promoting optimal performance while remaining healthy. So in case of sports nutrition, lots of physical activities were there. They were doing lots of physical activities. According to their physical activities, pre or post activities, we should give proper nutrition to the athletes or sports persons. The average fat content of the body is 15% for men and 25% for women. The average fat content of the body is 50% for men, 15% and 25% for women with either range of normal fatness. 10 to 25% for men and 18 to 32% for women. Normal wider range. The body fat can be further characterized in essential fat storage and non-essential fat storage. Then hypertension, elevated cholesterol, blood lipid level, higher cardiovascular, diabetes risk factor, strong chances of osteoarthritis, reduced balance and coordination with high fat mass. Thus, nutritional demand of sports and dietary recommendations. Maintain ideal body weight and body composition as desired of a particular sport. We should maintain one BMI level for a athlete's person. Athlete's person should maintain the good ideal body weight. Then maintaining adequate pool of nutrients. Then they should take according to their physical activities, maintaining adequate pool of nutrients. Providing diet that helps in achieving performance up to one potential. Clarifying facts and facilities related to food. Then energy. According to their energy, according to their body needs. In fact that the body needs energy to maintain body temperature to meet metabolic demand. According to their physical activities, they need more energy. Maintain electrolyte balance and support growth and physical activities. To support physical growth and activities, they need more calories as well as with electrolyte balance. According to the sex, age and body weight is mainly due to difference in the physical activity. According to physical activities and body weight, age and sex, we should recommend good quality of energy as well as electrolyte balance. Then matching energy intake of energy expenditure. To be in energy balance, an athlete needs to consume about the same number of calories that he or she expends on the daily basis. Energy intake need be adjusted during off season and peak season. So according to their physical activities, they need energy and matching energy intake with the energy expenditure. Whatever energy they will take, the energy will expenditure, how much energy they will expenditure, according to this they will take energy. ମାନେ ଯେତିକି ଏନର୍ଜି ସେ ନେଉଛନ୍ତି ଆଉ କେତେ ତାଙ୍କର ଏକ୍ସପେଣ୍ଡିଚର ହେଇଯାଉଛି ସେ ଅନୁସାରେ କ୍ୟାଲୋରି କାଲକୁଲେସନ ହେଇକି ଦିଆଯିବା ଦରକାର. ମେଣ୍ଟେନିଂ ବଡି ୱେଟ୍ ଆଣ୍ଡ ବଡି କମ୍ପୋଜିସନ ଆଟ୍ ଲେଭେଲ ଦେ ଆର୍ କମ୍ଫର୍ଟେବଲ ୱିଥ୍ ଗୁଡ୍ ହେଲ୍ଥ ଆଣ୍ଡ ଆଥଲେଟ୍ ପରଫର୍ମାନ୍ସ. lots of activities are there: swimming, gymnastic, long distance runner, middle distance runner, football, weightlifting, etc. Energy allowances are 80 to 90 and above, and energy requirements is 70, and total energy is 6000 kilocalorie. And if the body weight is 65, the person require 5200 kilocalorie. If 65, then 4500. If 60, 3600, then 63,000 calories are there according to the type of activities. Carbohydrate requirements in therefore essential to have sufficient store of glycogen before completion of the reference glycogen stores pre-exercise values within 24 hours. Pre-exercise values within 24 hours, there needs more carbohydrate. Carbohydrate is the fuel for the body. That's why they need to store glycogen in their body. They need the 24 hours. They need pre-exercise values and store carbohydrate in the form of glycogen. माने कार्बोहाइड्रेट जितने से माने प्री एक्सरसाइज करेंगे तो से अनुसार ग्लाइकोजन स्टोर पाई एनर्जी पाई कि फ्यूल पाई कि दे शुड नीड मोर कार्बोहाइड्रेट. Carbohydrate requirement may range for 55% in the average training diet up to 70% of the total energy endurance athletes. ଗୋଟେ heavy worker ବା heavy athletes 70% total calorie ର 70% carbohydrate they should need, their body should need. But athletes we should recommend it athletes as in our total calories they should take 70% of the carbohydrate. Type of carbohydrate consumed also affect the fuel store, and simple carbs are there in fruits, vegetable, honey, milk, other fruits such as refined state, table sugar, sucrose, etc. is simple form of carbohydrate which is easily turns to the which will easily turns into energy. That's why simple carbohydrate is very much necessary for athletes. Complex carbohydrates will constitute a chunk of total carbohydrate consumed. A variety of fruits, vegetables, grains should be consumed. In comparison to complex carbohydrate, the athletes needs simple carbohydrate for easily converted to energy. एनर्जी को जल्दी कन्वर्ट होगापाई बॉडी रे जल्दी एब्जॉर्प्शन पाई तो आमको सिंपल कार्बटा एथलेट्स मानक पाई कि दरकार अछि जेंति juices, honeys, honey water, sugar, glucose, etc. Protein requirement. Protein provides energy to the body, and ADA recommended is protein intake is 10 to 12% of the total calories. From total calories, we should recommend 10 to 12% of high biological value protein. Then amino acid used to repair muscle trauma, and repeated muscle contraction repairs to injury muscle fiber. थोड़ा सा physical activities बहुत चले तो muscle repairment पाएं कि the body should need good biological value protein. Then protein intake equal to 15 to 20% of total calories. Now it must be in good quality of protein such as egg, fish, meat, etc. And consuming more protein than 2.0 gram per kg body weight. 2 gram per kg body weight is very much necessary. Fat requirement is nervous athletes moderately to low fat diet. We should recommended amount should be high in cases of carbohydrate and proteins and less in fats. And vitamins and minerals. Vitamins and minerals perform the same essential function of the athletes and non-athletes alike. And energy requirement of the exercise induced production of free radicals. Higher amount of B vitamins and vitamins with antioxidant properties are required for athletes. For antioxidant properties, B vitamins is very much necessary, and therefore athletes with high energy expenditure 3000 to 6000 kilocalorie may need 1 mg for 1000 kilocalorie of thiamine, riboflavin, and in vitamins. Athletes should we should provide, but we should recommend as vitamins as thiamine and riboflavin, and 10 to 20 mg of niacin. And carbohydrate and protein foods are excellent source of these vitamins. When we will take carbohydrate and protein rich, our body fulfillment of thiamine, riboflavin, and niacin are our body should get through the carbohydrate and protein food. कार्बोहाइड्रेट और प्रोटीन रे बहुत अमाउंट रो बी विटामिन सब थाए तो आम जदि सही रिच रो फूड नबा तबे आमको जो जति थायमिन रिबोफ्लाविन नियासिन रो दरकार अछि बी विटामिन्स रो तो आमको सेटा मिल जिवो. Then intake of retinol may be placed in the 1000 2000 microgram per day. Vitamin E, which is an antioxidant, should be taken at the level of 10 to 12 international unit. Vitamin E is the antioxidant. It is very much necessary for athletes. And C, which is essential for iron absorption. So iron is very much necessary for athletes. So iron absorption paiki we should give proper amount of vitamin C. Pre-exercise or pre-event meals to fuel up muscles and brain. We should need glycogen store may be used to during night, a high carbohydrate snacks in the morning, and to require the refills of the liver glycogen store. Liver glycogen store, body should need body required glycogen rich food, a simple carbohydrate foods. And snacks should be at the time of glycogen store may be used during night, and high carbohydrate snacks on the morning events. Then snacks should be comprised high carbohydrate and low fat food, providing 500 to 1000 kilocalories should be consumed as snacks. High sugar food must be avoided to lead to dehydration, cramping, nausea and diarrhea. We should control our high sugary food on regular. Then maintain water balance and body temperature control, maintain normal blood sugar level, then fuel muscles and brains, delay fatigue. Thank you. Our nutrition is completed.